By now, no one should be surprised about the Delta variant emergence because that is the nature of virus. They mutate, evolve, adapt, and there has been the case with the coronavirus for a very long time. The result of the pandemic COVID-19, we feel we have been on the roller coaster because after one wave to second wave and third wave, and after third wave, we will see what's going to be happen. Hello, everybody. My name is Dr. Reshman Kumari. Today we are going to discuss about the Delta variant of SARS-CoV-2. Basically, every single person have the question regarding this pandemic COVID-19 and especially the Delta variant. Why the vaccinated people is still getting infected and why the sign symptoms of the Delta variant are different than the previous variant of SARS-CoV-2. What are the different sign symptoms in vaccinated versus non-vaccinated people, and what is the long COVID? The main question, why Delta is spreading so fast? World Health Organization officially stressed that mutation has potentially to be more deadly than other strains because it's more efficient in the way it is transmitted between the humans. Delta variant is ultra contagious. The pandemic expert says that Delta could be associated with the greater risk of hospitalization, especially in the vulnerable population. So the question is that who is the vulnerable population? The vulnerable population. According to the pandemic expert says, the Delta could be associated with the greater risk of hospitalization, especially in the younger patients who are not vaccinated yet and who are not eligible for the vaccination. That's true. Let's see how Delta variant become highly contagious and fastest and fittest transmissible variant of the COVID-19 are not indicate how contagious an infectious disease is. After months of the data collection, scientists agree the Delta variant is most contagious version of the coronavirus worldwide. It is spread about 225 to 1000 times faster than the original version of the virus, and it's currently dominating the outbreak in USA and the worldwide. According to the CDC, Delta variant is as contagious as chickenpox because Delta variant appears to spread as easily as chickenpox and causes more severe infections. If you see these mutations, mainly these two mutations in Delta variant, number one is the L452R. This mutation confers stronger affinity of spike protein for AC2 receptors. Affinity means increasing the binding ability of the virus to the receptors. And other is P681R. This mutation increases cell infectivity, so that makes the virus highly contagious. Guys, if you see the R naught number slide, the original version of the virus, R naught number is 2.4 to 2.6. That means at least 2 more people are getting infected from the one infected person. And the beta variant R naught number is 3. One infected person was spreading infection at least 3 more people. And alpha variant, through the one infected person, 4 to 5 people were getting infected. The Delta variant, which is currently dominating worldwide, number is 5 to 8. That means from one infected person, 5 to 8 people are getting infected. That is the reason it is labeled as a highly contagious variant of the SARS-CoV-2. Why the Delta variant causes a cluster of symptoms like a bad cold that were previously not prominent with the other SARS-CoV-2 variant. That is the main cause of the making patient health drops faster than the infection caused by the previous variant. That is the main reason it is spreading very fast. Clearly, this is because of the mutation in the virus. According to one of the virologists, Wendy Brackley from the Imperial College of London, these mutations are really quite crucial in changing the way that makes the virus that gain the foothold and latches on the airwave more efficiently. So because of this mutation, virus can sit in the airwave very well and they are able to fight off the local immune cells, so they could survive in airwave and able to replicate fast and the increased viral load, and they can transmit from one person to another person better way. Basically, there are the 4 mutations in the Delta variant on the spike protein which cover the outer coating of the virus that it gives characteristic spiny appearance. These proteins help the virus attach to the human cell, especially in the airwave like nose, throat and lungs. According to the Gavi Alliance and the Zoe study, progression of the symptom of the Delta variant start like headaches, followed by the sore throat and runny nose and fever. And the dry cough is much less common, and loss of smell is also not common too. And there's another thing. Is sneezing symptom of the COVID-19, or could sneezing be a sign of the COVID-19? According to the Zoe study, sneezing is the main symptom reported in the vaccinated population, either single dose or the fully vaccinated. If you see this slide, The sign symptoms in single dose vaccinated person are headache, runny nose, sore throat, and sneezing is the number 4 and persistent cough is again top 5. In fully vaccinated, sneezing is number 3rd and loss of smell is again top 5 symptoms. This suggests that sneezing a lot with no explanation after you have been vaccinated could be sign of the COVID-19. If you have been vaccinated and start sneezing a lot without the explanation, you should stay home, especially if you are living or working around people who are at greater risk from the disease. Like if someone is working in the hospitals or the senior citizen centers or the nursing home, and get a COVID test as soon as possible. So here is the list of the 21 symptoms, and keep an eye because COVID-19 infection can start with any of the symptoms listed above. The question is that why people are still getting infected with the Delta variant after having vaccine. So don't forget, vaccine made up of the original version of the virus called D614G messenger RNA genetic code, which produce antibodies after having vaccine. Due to the mutation in the virus, especially in the spike protein, which produce the protective antibodies from the vaccine become less effective. Vaccine do not offer full protection from the catching COVID-19 infection or from the mild disease of the Delta variant. But vaccine offer good protection against severe disease from the Delta variant and help to prevent hospitalization. But we don't know whether this vaccine is going to prevent the long COVID, mean to lingering health problem in the future. Long COVID means long-lasting coronavirus disease symptoms. It means the lingering health problem in the future, especially those patients who were suffer from the COVID-19 earlier. So they are divided into 3 types of the disease. This is not all. If we don't follow the guidelines, the more mutation and more variant would be emerging. Like the recent variant, Lambda variant, which first detected in Peru 2 months ago. Now Lambda is more than 30 countries. And Delta Plus was detected in India and it is also more than 40 countries. Some of the Indian scientists, they are really worried about the 3rd possible wave by the Delta Plus virus, and they are expecting if people are not getting vaccinated and they are not following the COVID-19 behavior or guidelines. So they are especially worried about the Delta Plus could be more dangerous, especially for the lungs, and they could lead the most permanent lung damage, the adult, and even more dangerous for the kids.